You've heard the saying, right? The eyes are the window of the soul. What they really are is the window to one's health. The eye is the only place in the body where a doctor can have a clear view of blood vessels, nerves, and connective tissue.
However, not many people visit eye doctors unless they have issues with their vision. So here to talk more about eye health is Dr. Julie Song. And she's a wealth of knowledge.
Yes.
So thank you so much for being here.
Thank you for having me.
But going to the eye doctor isn't just about getting new glasses or contacts. There's so much more you can learn, right, from an eye doctor visit.
100%. I mean, just as Dan alluded to, we are able to see into the eye and honestly not only evaluate ocular health, but also diagnose systemic disease as well. So if you have diabetes, hypertension, even autoimmune conditions, it's so incredibly important to go to see your eye doctor annually to determine if there's anything that we're missing in the back of the eye that we can be treating.
Yeah, how do you walk us through like a typical eye exam, right? Because like we said, it is when you have a problem. I had a sty. I'm like, I got to go to the eye doctor.
Yeah.
Other than that, it's like, why would I go?
100%. So I think when I think about ocular health and our eye exams in general, it's really a three-pronged approach. So the first one we look at is what we think of the most commonly, refractive care, so getting glasses, contact lenses. But the second is thinking about ocular health, making sure eyes are dilated and looking into the back, into the periphery, ensuring that there's, again, like I mentioned before, nothing that we're missing in the back of the eye. But the third is also evaluating binocular vision. So while we may see 20/20, we might still experience eye strain, difficulty seeing, and why might that be? But our eyes, our inability to work together as a team. So,
You know what I find really interesting is I thought in my last visit to the eye doctor, I thought that my vision was getting worse just because of age, and I figured, okay, when I get my prescription, it's going to be way worse than my last visit. But it turned out to be exactly the same, and I found out one of the reasons that I wasn't seeing well was because I have dry eye. And a lot of people
Yes,
have it, right?
absolutely.
So I use this. I use drops
I see her use
all
it.
the time.
Absolutely.
But that's not always the case that it's just drops that you can use. Can you explain what the
Yeah.
issues is and what the causes of dry eye are?
of course. So when we as eye care practitioners talk to patients, I mean, hearing the symptoms of burning, redness, grittiness in the eyes, this is not something uncommon that we experience. But what's important to remember is that the tear film has multiple layers. So the first layer is that watery protein-like layer that we utilize eye drops in order to help. So things such as preservative-free artificial tears can really help aid that water layer, but a lot of times what we're missing is that oil layer on the top. And
Okay.
so for us as eye care practitioners, we treat dry eye as multifactorial. It can't just be that we don't produce enough water. Oftentimes we don't produce enough lipids.
Where's the oil coming from?
Yeah, so great question. The oil actually comes from the oil glands in our top and bottom lids. And so when we evaluate that, a lot of times I commonly see patients have clogged up oil glands. It's stuck in there like butter, and then we need things such as an eye mask in order to actually heat those oil glands and melt that butter into olive oil. So all of these different multifactorial reasons why we have dry eye are so important to be diagnosed and evaluated by your optometrist.
I use that eye mask, and now my vision is better because it
There you go.
melted that butter in my
Yeah.
eye.
She has the dry eye. I have, yesterday my eyelids got like double in size because of allergies. And your tendency is to take your fingers and just scratch your eyes, which of course could lead to infections. But so what is your best relief, besides like medicine to take for allergies, to kind of deal with an eye issue during allergy season?
Yeah, and you just hit the nail on the head. First, avoiding that rubbing. It's so difficult to do it because it feels so good, but all we're doing is just releasing histamine over and over again into the eye. So avoiding the rubbing, using instead something like a cool compress. So anything cold, any of the eye drops that you have, you can refrigerate and put into your eyes, and that will give you additional added relief. But truly, it's so important to still get your eyes checked and make sure that the allergies that you have are truly the run-of-the-mill ocular allergies and not something more sinister that we should be treating with medication.
Okay.
Like an eye wash, you could use one of those.
Potentially could use an eye wash,
Gosh,
yeah. Sometimes it's even just the inflammation along the eyelids that we can use something, for example, like an eyelid wipe in order to really just remove that debris and remove those just irritating factors. But figuring out what you're allergic to and getting away from that is, definitely an important factor to consider.
Good stuff.
Great information, Dr. Song. Thanks for coming in.
Thank you so much for having me.
Yes, appreciate it.